Mr. DeLauro.
Thank you very much. Sorry, Ms. Letlow left, but I think it's important to note that in the 2026 budget and under CDC, the breast and cervical cancer program has been eliminated. I think that's important to understand for women's health. Also, Secretary Kennedy, you committed to following the law and awarding congressionally appropriated funds in 2025. And please understand that we are in 2025 and we are under the continuing resolution, which is the 2024 budget. So quite frankly, it should be an easy transfer to 2024 to 2025. But that is what is operative. That is the law of the land, not a suggestion, not a directive, a law of the land. But the evidence suggests that you are cutting billions of dollars in funding right now. The evidence shows that you are withholding at least $2.7 billion in life-saving NIH research, and that is only midway through 2025. And based on the evidence, I believe, and the OMB director has indicated, that you are going to illegally impound billions of dollars of congressionally appropriated funding for NIH research in 2025. To make matters worse, you are proposing to cut NIH funding by $20 billion in 2026. You do not have the authority to do what you are doing. Congressman Hoyer pointed out that very clearly and explicitly. You don't have the authority. This administration does not have this authority. You're reorganizing of the NIH. You don't have the authority. That is in the jurisdiction of the United States Congress. You want to eliminate 5 agencies. You want to create a new agency once again. I don't mean to be repetitive, but I do mean to be repetitive. You do not have the authority to do any of that. A couple of other areas I think are important. HHS makes medical decisions every day. You're making medical decisions every day. You're the secretary of HHS. You have tremendous power over health policy. Really horrified that you will not encourage families to vaccinate their children, measles, chickenpox, polio. Vaccines are one of the foundations of public health. Vaccines, yes, save lives. And the fact that the Secretary of Health and Human Services refuses to encourage children to be vaccinated is a tragedy. And we have already had 2 children in the United States who have died needlessly from measles. Let me also move forward. You talked about the NIH and the science at the NIH. And just very, very quickly, high-profile successes from NIH research: Human Genome Project, immunotherapy, CRISPR gene editing, sickle cell cure, vaccines for HPV, hepatitis, mRNA vaccines, including the life-saving COVID vaccines, artificial heart valves, GLP-1 medications for diabetes and weight management. It is one can look at and see what works or doesn't work, but you can't sit here and tell us that NIH has been a failure and that the science and the people who have worked at the NIH have not made unbelievable discoveries to cure. I have a question which had to do with NIH. And you don't have to answer this question, but I don't understand why Republicans get to call you to spare offices like NIH. Who do Democrats have to call? Is there a special phone number if I want to save tobacco prevention, lead poisoning? 9 million children were lead poisoned in Flint, Michigan. 9 million kids, okay? So tobacco prevention, lead poisoning, oral health. Who do we have to call to be able to get those things reinstated? And finally, let me just say this to you, because there's been a discussion here. Well, on nutrition, I would just say to you that, look, I'm very, very big on nutrition, food safety. I've spent, the last 20 or 25 years dealing with this issue. So I'm supportive of some of the areas that you have talked about. And by the way, the Office of Research at the NIH, they can only spend $1 million on research. This committee can provide them with a hell of a lot more money if we want them to do more on research. But and a side issue on Medicaid with regard to young children, it is children, disabled, low-wage workers, and seniors who are the beneficiaries of Medicaid. And that would appear to be really on the chopping block, Mr. Chairman. I have just one more comment to make to you. The testimony with regard to unaccompanied children, I spent a lot of time on that issue, a lot of time. Because by law, as you know, we have to accept unaccompanied kids. That's HHS responsibility. You're right, there is an enforcement. But we have that responsibility to keep them safe, put them in the best set of circumstances. I was chair of this committee during the first Trump administration. Still outraged. I was horrified at the time to learn that Stephen Miller was directing border agents to separate children from their parents as a deterrent to coming to the United States. Some of these children were taken away from their parents. They were less than 5 years old. Now, there was about 4,600 kids separated from their families. Today, that was in 2017, 2018, I had a conversation with Secretary Azar at the time. It was in my home, in my office, with my grandson on my lap. And I said to him, do you have a list of the families and a list of the children so that they can be reinstated? He assured me that they did. Mr. Secretary, it's 2025. 1,300 of those children are unaccounted for. Do we want to look for missing kids to get them to their parents? Let's start there. That was a tragedy of great proportions inflicted by the United States of America. You have an unbelievable job. You have, when we talk about HHS, it really is a cornerstone of what this country is all about and what we can do. We don't deal here with airplanes, with roads or bridges or helicopters. That's not what we do. What our job and your job is to save lives. And I would hope that you would take another look at what is being proposed. And I would say, fight back, as I would ask my colleagues to fight back and say, we can't do this. We can't eliminate some of these programs. The havoc that we are going to cause in dealing with research and cutting back on research is going to put lives at risk. You have an incredibly important job.
Thank you, Ms.
I think
DeLauro.
you can make the difference.
Thank you.
Please do.
Thank you.